Welcome back to the new norm. I'm Dr. Lou Graham, and this program is brought to you by Midway Dental and Catapult Education. I don't know if I call it kind of pseudo-dental chaos, what's going on. We're going back to practicing. States are opening it up. And where do we go from here? I mean, don't misunderstand me. I want to get back to work. Everybody wants to get back to work. But how do we do this in a safe and I'd say predicted manner? We've talked about screenings. We've talked about testing. We've had Steve Kizzy on talking about the issues with PPE and getting PPE. And all of a sudden, for example, in Illinois, Governor Pritzker says we can go back to work. Well, that's great, but I need PPE to do it, day in and day out. And PPE is hard to find. The right kind of PPE is hard to find. So with that all said, I really want to dive deep into the dental hygiene world. I love this world. This is part of the world I teach on, and I've got a wonderful, wonderful guest in Amber Auger today. And in talking to her, and you'll see, there's just a great vitality in the way she approaches both her teaching and really her discussions. She's laser trained. She's so involved in so much of what I call the current aspects of dental hygiene that I couldn't think of a better guest to bring on the show. So Amber, first off, welcome to the show. It's great to have you here.
Well, thank you so much for having me. I'm excited to be here.
This will be great. I love this. So I guess, Amber, here's my world. My world is I want to make sure my team is safe. My team would be, whether it's my front team member, whether it's my assistant, or whether it's my hygienist, and I have multiple of all of the above in my practice. Let's talk hygiene today. And let's cut through all the crap out there. Let's say, what does it take today, reasonably so, for a hygienist to go back to work and do what he or she loves to do, dental hygiene? What do you feel are the proper PPEs that a hygienist should feel comfortable going back to work these days? And we'll get into far more. Tell me what your thoughts are.
So it's a great question. And for me personally, for me to be able to feel comfortable to go back, that's going to involve me having some sort of high-speed section, such as the PureVac. Thankfully, I already operate with that on a daily basis when I am chairside. It will involve an N95 mask, of course the disposable gowns, and a face shield, which is extremely important. I've actually even debated for the first time in my life wearing some sort of surgical cap while I'm chairside as well. Because if you think about it, you remove all of your PPE, even though your hair is still up and pulled back, in my case having a longer hair. I don't want to have those aerosols lingering in my hair and then head to the gym after work. So it's all about how we not only protect ourselves, but the community as a whole as well.
Right. So first off, I'm all over the hair thing. After being surgically trained at the University of Chicago, well before you were born, I would think, I would absolutely say hair coverage is essential.
It's my night cream, Lou. It's my night cream.
Exactly. I would think hair coverage, absolutely. Look, I'm into shoe coverage. I mean, we have our own protocol. But, you touched on something that's really interesting. I absolutely believe in the N95 mask for the hygienist. Like, as a doctor, I would be absolutely using the N95 mask also. Let me cut further into what you said. Talk to me about your experience then with Dentsply's PureVac, because I'm having them come on the show. This has been around in dentistry from my discussions with them for almost 2 years plus. So tell me what you have found with this, because I'm seeing great possibilities in dental hygiene with it. Why don't we touch on that a little bit, if you don't mind?
Of course, I don't mind at all. So,
okay.
For me, with knowing the science behind the power instrumentation, removing the biofilm, and I love being a perio nerd, using my laser, I wanted to make sure that I was using everything with the science behind it.
Right.
And I looked into other, isolation systems, other high-speed suctions, and they were hard to use.
Yes.
For me personally, I don't have the privilege of having a hygiene assistant. I don't have someone who will sit there chairside with me and maneuver the, high-speed suction so I don't suck off someone's toupee or cheek. And of course, ergonomically, it was very difficult to try to maneuver that while scaling. So I did some research, and thankfully I have a great relationship with Dentsply. I was a part of their hygiene circle and was able to learn all about the science behind that HVE. It's very easy to maneuver, ergonomically designed, mirrors attached to it so I don't feel like I can't see on the lingual surface. And the research is really behind a higher diameter for the aerosols to be collected.
Right.
So we're looking at, the science behind that is an 8 millimeter is important to have with the reduction of the aerosols.
So I want to just take a little bit diver deep, because a lot of our attendees really, or listeners really don't know about this. And like for me, I thought it was a new product, and then obviously it's not a new product. I mean, it's relatively inexpensive in the sense that I think it's roughly around $200. You get 3 mirror heads, and it's very easy to self-install into your high-vac system. In your experience, how long did it last before you needed to order like the replacements of the system, since you've been using it for 2 years?
That's a great question. I would have to look back at the ordering to be super specific on it. I practice 2 days a week, so I typically do 12-hour days. And I would say maybe 3 or 4 times. It wasn't anything that I can, think back and say, oh, it was the last 90 days. So it tends to,
I'll find out more when I interview them, but I know in my reading that you can absolutely get multiple reuses out of it. It's not like you're spending $200 and you're getting 3 uses out of the 3, suction mirror, suction mirror as far as part of it. But I do see this, Amber, as a huge thing for hygienists regarding aerosol. And I think this could be something more like mandatory, or some system like it, to allow the hygienist, when they're going to use ultrasonic, which we'll get to, I think it gives them a little bit better peace of mind. Would you agree on that?
I agree 1,000%. And the reason I couldn't tell you as well in regards to how often we change it is because our office assistant as a whole has an amazing protocol that she does it for me when I'm not there.
Right.
So
of course.
We have it listed of, the recommendations and the MDS sheets of when to change it out.
Okay, so I love that as one of our great, I think, key points. I think that will be one great key point out of this, as part of almost a necessary PPE for our offices when we start getting back into hygiene. Now, don't misunderstand me, Amber. I really believe the hygienist is probably one of my critical partners in long-term in building my practice. I swear up and down about the value of my hygienist. So with that, before we get into the exams, I want to talk about scaling. We talk ultrasonics, whether piezo or magneto, and let's talk about the world right now of aerosol. That's the big bugaboo with hygiene, as it should be. Hand scaling versus ultrasonics. Okay, where are you at on this?
So I am the first person to want to talk all about that power instrumentation.
Right.
And of course, with that power, there always is a place for hand scaling. I don't think that you can effectively treat the whole mouth without ensuring that you're also hand scaling. With that being said, if the clinician doesn't have the N95 mask, the face shield, the proper PPE that's being recommended, the disposable gown, and that HVE system, I wouldn't feel comfortable personally or recommending to my clients, as the other hygienists around the country, that they should feel comfortable picking up any power instrumentation. We really need to ensure that the aerosols aren't lingering. We know the clinical studies say that the COVID can last up in the air, those droplets, for up to 3 hours. So we need to make sure that we're not, creating aerosols, taking the bacteria that's in the mouth, creating them into more aerosols and letting them linger in the treatment room. So
let me take a non-political stance, but ask you this. In the world of reopening a dental office, if we had to put off dental hygiene for a month, until we could get all the proper PPE really into the offices so hygienists could really work comfortably, maybe see a few less patients a day, maybe one or two less because they've got to turn over the room, allow whatever time as far as everything, as far as disinfection goes. I mean, do you really see it bad to wait a month until the hygienists have the proper PPE? Because right now I see dentists need the proper PPE and the assistants in order to see the emergencies and maybe the initial patients who we've been waiting to see with broken teeth. I mean, do you think it's wrong? I mean, I think we should wait. I mean, and again, I know hygienists want to get back to work, but I agree with you. I think they need the right PPE to open their doors. What are your thoughts?
Yeah, I'm with you 1,000%. I mean, I am the first person who wants to get back and treat my patients and chat with them. I love that, to be able to have that personal connection with them, as well as, heck, I've never wanted to scale teeth more in my life. My dog, I've been going at my dog with my scaler, make sure I got my, my skills up. But with that being said, I think in all seriousness, we shouldn't be taking the limited PPE from other professionals either. Nurses who need N95 masks, they should really be the priority when they are treating COVID patients that, they've tested positive for the COVID. We want to make sure that we're protecting everyone and not just in our dental practice.
I really agree. I think hygiene, if they have to, I just know after interviewing Steve and seeing how hard PPE is to get across the board in the United States, I think we have to be thinking as dentists, let's get our practices rolling first with what procedures are absolutely necessary to be doing for those patients in need. And I think hygiene comes back openly when we have proper PPE and proper safety in the office. And listen, I know not every office is going to have filtration systems and these other things, but if we can minimize aerosol like we have talked about, I think this with proper PPE becomes almost essential with good screening protocols to minimize COVID coming into the office. Are we in pretty much good agreement there?
Oh, absolutely.
Okay. So, we have more similarities. You and I are both big believers in lasers. So,
yes.
I know, and in my previous episodes, I had talked about not using initiated diode lasers because of the plume. I'm waiting to hear more about the research on the plume. Some people say, well, the virus is killed based on the heat contact. I'm cautioned. I probably will suspect that will be true, but I don't want to be breathing any virus. That's how I look at it, even with all my masks on. Okay. Talk to me about your protocol then with a diode laser, because you are ALD certified, you teach this. Where do you see lasers fitting into today's protocols?
Well, I'm in conjunction with you, right in alignment, where I don't think we should be focusing on initiating the laser just in case. So typically when we look at the laws, throughout the United States and state by state for what a hygienist can do, and that's really where I focus, is the non-initiated laser. So there is clinical science behind the low-level bacterial reduction that you can do prior to a procedure, as long as you are using some sort of high-speed evacuation system. So what it will look like, in my practice when I do return back is to go ahead and do the low-level bacterial reduction before doing any hand scaling or power instrumentation, depending on, again, what I have for my PPE.
So let me just hear, so for our listeners, you like to decontaminate the pockets prior to really going in with power, basically, correct?
I do.
Yeah,
I
exactly.
do. And then depending on how the tissue looks, I mean, if I'm seeing, a lot of bleeding or I'm seeing continuous areas of inflammation, then I'll go back through again with the laser before the patient leaves after the scaling and the air polishing. That's typically just how I'd like to, structure my appointment based on the science that I've investigated.
I love it. So, and I agree. So I wanted to touch on that, but now I think what I really want to touch on is the recall exam. And I'm going to love this discussion with you because I think the new norm is going to have a total different recall exam for the next 16 to 18 months. I'm calling it right here on the show. We've said a lot of I'll just say opinionated things on the new norm. I'm going to just say, but they've been justified. I think we're going to have a new recall exam. I don't see putting on a new PPE to walk in and taking off my previous PPE in order to go do a 5-minute exam. I just don't see that at all. It's going to be too expensive, too costly, and we're throwing too much, just too much away. So before I get into this, tell me how you envision the recall exam of the new norm. Talk to me.
Yeah, so with the recall exam of the new norm, I envision using some sort of technology for teledentistry. Now, whether that is the smart mirror with Midway Dental or that's something like a teledent software, to have the hygienist pick up the intraoral camera where they can do a video exam of what's in the mouth, then of course collect the data as they normally would. The medical history update, of course taking temperatures is going to have to be implemented.
Yep.
Doing a pre-screening before the patient even gets in there. I know you had a great episode on the 10 questions that you want to ask, prior to the patient coming in. And then, the films, all that data and assessment. I don't feel that it is responsible for the dentist to see the patient that day because we want to limit and preserve PPE. And we don't want to be changing those disposable gowns, which are already on back order, right? So we want to be able to eliminate how many patients come in contact with our disposable equipment, whether it's the N95 mask or face shields, whatever it may be, and be most, effective in our workflow. So I envision having the exam done digitally and then the doctor following up with that patient after. So not seeing the patient that day, it also reduces the amount of contact that we make with each other throughout the day and with multiple patients. Then from there, the business team can follow up and say, this is the treatment that you need to come back in for. And the doctor can see the patient the day of the restorative treatment.
So let's talk more about this, because if there's a list, I'm telling you, we have thousands of listeners, and I have been getting so many emails on the recall exam. So let's dive a little bit deeper into this.
Mm-hmm.
I love this. So my feeling is when my hygienists from our morning huddle, they know what x-rays to take, whether, for example, we don't even take a full mouth series anymore. We take a cone beam scan versus an FMX. Radiation's the same. It's much more comfortable. So we can get that done that day. Bite wings, vertical, horizontal, the hygienist can read those. We use Carry View for transillumination on patients. We use Spectra. We use a variety of different things for caries evaluations. You're doing your oral cancer screenings. You're doing all that. And now if you could take a video of the mouth and almost now report it to the dentist, what your findings are, let's say at lunch and at the end of the day, is that your vision of what I really see the hygienist really walking the walk of being the eyes of the dentist, really helping their dentist be their eyes diagnostically. What are your thoughts on this? Do you agree?
Oh, absolutely. And if you have those structures set up prior, you'll be good to go. If you don't, it's as simple as structuring a morning huddle, identifying what the hygienist should be looking for. And if you don't already have those, it's kind of a terrible thing because you're not really tapping into the diagnostic abilities of your hygienist. In addition to that, without having the doctor, come over, do the exam, have that time, that hygienist has additional time to now do the previous recommendations that they may not have been doing, such as running the lines, making sure that everything's sterilized, and walking that patient, out back to their car and following up with the team member, the business team member, of what will be needed to move forward for the patient.
Yeah, and I just want to say this to everybody out there. So here's really where, once again, teledentistry comes in. So let's pretend in the world Amber's taking a job in my office and working with my team. I'll talk to you later about that, Amber. And Amber now comes in at lunch and says, I saw these 3 patients. Here are the findings. Now, if everybody's within normal limits, I don't have to follow up with them. But let's say Amber shows me recurrent decay on number 20. Or I'm now looking at a cone beam scan and I see a periapical issue going on. All of a sudden now, I would then take that information, I would email the patient and say, click on this link, and I would do a consult as part of my recall exam. And I see what Amber does. I really see this, and then we would just book the appointment with my team. I really see the recall exam changing. And I'm gonna tell you, before I even talked to Amber, this is exactly what she was thinking. This is what I was thinking, and I think this is what we're gonna have to bring forth moving forward for the next, whatever, 18 to 24 months until there's a vaccine, or however I look at this.
Right.
I love it, Amber. So do me a favor, before I say temporarily goodbye to you, is there anything else that you would like to bring up at all?
You know, I just want to say that now is the time where we can change dentistry forever, and we can change the trajectory of where we're going. I think there's been so many amazing technologies, and we've all been kind of stuck in the rat race, haven't been able to wrap our minds around different things. Our patients are calling us to pivot, and our patients are calling us to offer solutions such as the teledentistry. And we have all the tools. It's just time to tap into those and make a plan.
You're wonderful. I can't thank you enough for being on our program today. To all the viewers out there, I think once again, Amber and I would just say, like we would close every show, be safe and be smart. This is Dr. Lou Graham for The New Norm. We'll see you soon. So let me be clear. We want to hear from you. We want to hear your questions. So what we want you to do is we want you to go to education@midwaydental.com. Shoot us your questions. We'll go right to the experts. I know I'm not the expert, so let's go ask the experts what we should be doing as our next step next week, the week after, and thereafter. I look forward to hearing from you.